Hey manual therapy friends, we're going to do a thoracic manipulation in supine today. Now, in my experience in teaching students and fellowship students and anybody out there that I've taught with that it has a physical therapy background, this is like the hardest one for them to do because usually their hand is tough to place under their back, and then the way the arms go and how it pokes their chest. And for ladies, you know, it's always a problem with chests and elbows and chest and all that stuff. So I'm going to cover with you today the way that I do this. The thrust is also a factor. You don't need a giant thrust. Whenever I have students, they cover this in PT school oftentimes, but they teach students, from what I've seen anyway, to give a massive thrust and almost take the wind out of the patient. But it really doesn't take a whole lot of force. So the way I'm going to teach you today, you're going to take up the slack effectively so that they might even just start popping and cracking before you even thrust. That, in my opinion, is the best way to do it because then it's very comfortable for the patient. They'll feel wound up, but you're not winding them up and squashing the heck out of them. So obviously patients in supine, you're going to tell the patient to cross their arms, and cross them wrong because everybody crosses them wrong. No, you did it right. Yeah, they'll cross them like that, and then the patient just automatically does that. You're going to come in and correct them. You need them to have elbow over elbow like that. And the reason is if their arms are crossed like this and you thrust, it hurts. Their forearms crossing each other, it hurts. So once they're in position like that, then what you'll do is you'll reach over your right hand. You're going to get it under the spine, right in the middle of the spine. Now let's talk about grip for a second. I use what's called a collapsible fist. So I'll make a fist, but I'm not holding it hard. It's collapsible. So once the body weight of the patient falls on, my hand kind of opens up like this, but I'm still maintaining my knuckles just a bit like that. I don't use any tools. Some people hold like a towel, or I've seen a chapstick or a pen, something small and circular. I'm just not a big fan of that. I think it can potentially hurt your fingers, but you got to find the ways that work best for you. And if a towel or a magic marker works best for you, find the best way to do it. So once you get your hand in position, their spine, ideally the spinal vertebrae, the spinous processes should fall in the valley of your hand. So watch where my elbow's at, because what I'm going to do is as I lay him down on my hand, I'm going to take up the slack. So my elbow's against his hip right here, and as I roll him onto my hand, I'm going to flare out my elbow and I'm twisting his skin a bit in the back. So that gives me a great skin lock. I'm already putting a little pressure on him, and you see where my hand is? It's over near his hand, and his elbows are near my tummy, but they're not pushing into it at all. They're kind of more in line. My body's in line with his humerus, so I'm controlling his arms with my arm, and I'm going to tuck his elbows under. Then just leaning into it like that, it's going to start to go already. And if I need to give it a little extra thrust, I can just give it like that. And it cavitated right away, without a big thrust at all. You can go a segment lower. I'll show you again. So I got my collapsible fist, flare out the arm, tuck this under, give some pressure, and that's it. Easy. You didn't see him coughing or choking afterwards, and it was gentle on my hand because the big thrust you give can definitely hyperextend or hyperflex your joints, and that's not comfortable. So if you need help with a thoracic manipulation, I'm happy to talk more about it. A lot of people have trouble with it. The benefit of doing a supine thoracic manipulation versus a seated or a prone technique is that you can get very, very targeted with this and create true extension at the spine. Because if you think about it, when they're in seated, they're vertical, so it's hard to get a fulcrum right on the spot that you need to on the thoracic spine. And then when they're in prone, they're relatively in kyphosis. So you can create an extension moment, but you don't get the advantage of having the weight of the body helping you out with the extension moment as you do in the supine technique. So I find that this is much more targeted, much more effective, and if you can do it like this, it's very comfortable on patients. So if you have any questions, hit me up. I'm ready to help you. Thanks. Bye-bye.